Today I'll talk about common mistakes made during blepharoplasty. Blepharoplasty or eyelid surgery is a rejuvenating procedure in general, and cosmetic surgery, this procedure is done to give your face and your eyes a more youthful appearance because as you age, the first part that usually ages is your eyes because one, the skin on your eyes and the structures are very thin, so they lose their elasticity early from aging and gravity. So, number one mistake in blepharoplasty procedure is not extending the incision to the sides of the eyes. There are surgeons who just do blepharoplasty in the middle part of the eyes and afraid of extending the incisions to the corner of the eye. So what happens here is the drooping part. Sometimes the eyes, and actually most of the time, the eyes droops on the sides or in the lateral sides. It's hooding on the lateral sides, and there's a term for this, dermatochalasis, and it droops down, and sometimes your peripheral vision gets affected. It's like horses with blinders here. When you do not cut or you do not address that one, you will end up with rounded eyes, something called puppy dog eyes or your sad eyes, because your eyes would look more rounded. The skin excess was addressed in the middle of the eyes but not extended. What a surgeon should usually do is extend the incision along the natural crease of your eyelid and retain that almond-shaped eye. So, ending up with a puppy dog or sad-looking eyes is a telltale sign that you were operated on, and it also looks very unnatural. Number two is not following the original eyelid crease. Especially in Western eyes and also Asian eyes, you have that crease that's formed on your upper eyelid. Depending on the ethnicity of the patient, let's say your Caucasians have an upper eyelid crease that is higher. In Asians, it's a little lower. And if you do not follow that original eyelid crease and you tack it or you set it in a predetermined area that is too high, and maybe create that crease in a location higher than the original crease, you end up with an eye with multiple creases. And again, this looks very unnatural, and it doesn't really make you any younger. So you have to put the predetermined crease or your eyelid crease usually in the lowest crease of your eyes. So it's quite confusing sometimes, especially in patients with multiple creases, which is the original there. You should determine which is the original one, what is the part that is creating that line there, and you should put it there. Okay, number three, very common mistake, especially those eyelid surgeries done before, is not addressing the volume deficit of your under eyes, actually of the face and the eyelid area. When you age, to explain this, I'll show you this picture of the aging face. When you age, it's not just tissues going down or skin getting inelastic and falling down. It's more of a loss of volume. So usually in your 20s, in your 30s, if you see this picture, the yellow part is the fat on your face. It's very homogeneous. And if you look at a baby's or a teenager's face, it's all evened out because this fat is all homologous, and it blends all over. You cannot see the demarcation from your eye bag to your cheeks. And when you age, on your starting in your 30s, 40s, especially on your 50s, especially in women who have undergone menopause, you have a loss of volume, meaning these fat compartments, they shrink, and between these fat compartments you have spaces. These are natural spaces because originally these fats are inside compartments. However, when it shrinks, these gaps or spaces increase in distance, and it's hollowed out, creating a valley there. So the location is very consistent. So usually one very prominent crease is it goes down from the corner of your eyes or your tear trough down all the way down to your Indian lines. So you have a line going down here, and it looks like it's pulling your face down. So even with the blepharoplasty procedure, if this is not addressed and there's hollowing out of your eyes around your eyelids, then you would still look like you are tired, and the hollowness was not addressed. Right? Today, we call this volume redistribution surgery, meaning we redistribute the volume where it was lost, and a lower eyelid procedure called the fat repositioning blepharoplasty, where the fat in your eye bags or your eyelids is repositioned to fill those gaps there, and sometimes, most of the time, it's lacking. So fat injection around the other areas is done. The result is what is lost is replaced. What is lost is replaced by the same tissue. This is the best way, in my opinion, to replace. Of course, there are other procedures like your fillers, which is in another topic we can talk about. But I always say, if you're having surgery, especially in your eyelids, it's a good time to put fat around those eyes. And at least you address what is lacking. A number 4 mistake. I call this a rookie mistake because one is removing too much eyelid skin on your under eyes or lower eyelid. So no matter how much skin you remove, you cannot really pull everything until you will look younger. That is not the case, and you cannot really remove too much skin under the eyes, because one, if you pull it up by gravity, that skin will pull back, and it will pull your eyelids down, and this will cause a condition called lower eyelid retraction, or your ectropion, which is your eyes going this way. So this is a complication of too much skin and too much scarring involved during a lower blepharoplasty. It is more common in elderly patients and patients who have had a previous blepharoplasty procedure. Why? Because in elderly patients, the skin and the other structures on the other eyelids, like the tarsus, which is the one that's holding your eyelids together, is very loose already and going down. So removing skin there just a little will really pull it down, and it's easy to get this condition called ectropion. In patients with a previous blepharoplasty procedure or previous surgery there, skin has already been removed by the previous surgeon, or if you were the old surgeon, maybe you were the one to remove that skin, and you remove more skin, and you have a small margin of error there, and there's a higher chance that you have this complication. So how to avoid this one? Of course, one, you always check. There's an easy check. It's called the snap test, or your lid snapback test. So, what you do is you pull the lid down and you release it, and the eyelid should instantaneously go back to place. If you do this in the mirror, you can see. However, in some patients, that eyelid will go back a little slower, or it takes a little time for it to redrape back. Or in worst cases, the patient has to blink to reposition that eyelid. So this is one sign that you have a high risk of having a ectropion when eyelid surgery is done to you. So, however, your surgeon should be aware of this and should be able to correct this condition. So, usually in patients with a positive snap test, I do a lid tightening procedure, which is called a cantoplasty, together with your blepharoplasty. What it does is it tightens that lower eyelid, and at least it tightens it, and there's less chance of the skin pulling it down. Minimal excision of the skin is also important in this case, and I combine it with laser resurfacing of the skin to tighten the skin instead of cutting the skin. It's even better because it produces more collagen. The trauma of the stimulation of the laser to your eyelid skin causes it to create more collagen and elasticity. And another way is going transconjunctivally, or your transconjunctival blepharoplasty, which means it goes through the inside of your eyes. There's no skin that is removed, and only the fat is removed in that procedure. However, most patients with a lot of skin there, or elderly patients who have lost their elasticity and there's a lot of skin there, you might transconjunctival blepharoplasty may not be the best approach, because you cannot you don't remove some of the skin there, and it would be more prudent to do a lid tightening procedure or a cantoplasty together with your blepharoplasty. Number 5, not checking for ptosis. So before we discuss this, what is ptosis? So ptosis is a condition where you have drooping of your upper eyelid, not because of the skin or the fat there. That term is called pseudotosis, which is aging related. True ptosis is because the drooping of your eyelid is because of there's this muscles that keeps your eye open, your levator muscle. Sometimes there is weakness or loss of elasticity of this muscle. So you cannot hold your eyelids open, and little by little your upper eyelid is drooping down, or sometimes called your lazy eye or your sleepy eye. It can happen in one side only, and it can happen in two eyes. And sometimes it's congenital, meaning you were born with it. Most of the time, it's one-sided, and it's also aging related. So in some patients who, especially again, in elderly patients, this is very common. So why is it important to address or identify ptosis before any eyelid surgery? One, because initially it's not really obvious, but if you do not check for ptosis and then you do a standard blepharoplasty procedure, you might end up actually making it more seen. And that's the time when you see that, oh, you really had ptosis. Now it's more evident because all of the skin and was removed. So your doctor can easily identify the ptosis in your eye. So usually I do a eye shine some light on your eyes with a flashlight, or take a picture of you with a flash, and then if you can see in this picture, your the flash or the light reflects from your eyeball. This is your corneal shine or your corneal reflection. So it's the reflection of the light of the camera or the flashlight on your eyeball. And usually, because the eyes are round and it's in a consistent position, the position of this shine is usually consistent. So it's a good reference point. So I measure the distance of the edge of your upper eyelid, or where the eyelashes are, and that shine, and compare it to the other one. If the if there is real, especially in very advanced ptosis, sometimes the shine is already covered by the upper eyelid, or is already um, next to the edge of your eyelid. So if this is the case, then ptosis should also be corrected during your blepharoplasty procedure. This is usually done together, and this is done by tightening the muscles or reattaching a part of your eyelid called the tarsus, where that muscle attaches, and reconnecting it to your levator muscle to open up your eyes more. And usually it brightens the eyes after the surgery. So these are the common mistakes or things that are overlooked when blepharoplasty procedure is done. Remember, not all eyes are the same. They age almost the same, but they come in different conditions. In summary, things that you should really address is one, but I'm always pointing out, the volume. Volume plays a big role. So you can do your fat grafting or fat injections during your blepharoplasty. Sometimes I said you should do it during your blepharoplasty, or else you won't look any younger. And hollowing your eyes out will just look make you look older. And aside from that, you should address the color of the skin, the darkness of the skin. Fat grafting also thickens that dermis under your skin, and the reason why you have those dark circles on your under eyes is the skin on your under eyes is very thin. Naturally, it is thin. There's almost no fat under that one. And under that, you have your muscle and blood vessels. Muscle is usually color red. So when your skin is very thin, it trans-illuminates, and you can see the muscle under there that gives you a bluish hue under your eyes. So injecting fat, particularly nano fat, thickens that dermis and conceals that a bit. So there is improvement of the dark circles under your eyes. Because this is also the topic now, I'd like also to show one of my patients who came in because she had surgery elsewhere, and this was her before, and this was her after the first surgery. And if you see, she did not look any younger than the original. Actually, I told her that the original eyes was even better than she was better off where she started. So what was the mistake, or what was the thing that was not addressed? Again, one, the eyelid crease was put too high. So sometimes we want to replicate a Caucasian eye or a Western eye with an Asian eye, but it really doesn't fit. So what happens is they call it a deep set eye, so that the tarsal show, meaning that area where you put your eyeliner on, is too high or too wide, and it gives that eye sometimes an operated look, especially on an Asian face. It gives the eye not a youthful look, but something that looks quite odd and surgically done. Aside from that, too much fat was removed, and aside from that, the whole eyelid looks sunken. So you have two things there that has to be addressed. Luckily, this was a patient. I said we cannot bring back the original eye because it was anatomically altered already. So we had to remove everything and reposition the crease to a more correct position to hide that tarsal show, and also reposition. Luckily, she still had fat there, and add a little more fat to give a little more volume to her eyes. So this is the result. She also had the fat grafting under the eyes, and I also revised her nose. So after the surgery, maybe not perfect, but a lot better from where she started off. More natural, and does not look too operated on. Okay, so again, eyelid surgery may seem very easy. It's not one surgery fits all. Blepharoplasty may be for you, but not for you. It's a good thing that you should study how your eyes look. Discuss this with your doctor, and I'm sure your doctor can have the correct procedure for your eyes. Okay? So thank you again. If you like more content like this, please like, subscribe, or hit the comment below. And if you have any suggestions on anything you want to talk about cosmetic surgery, leave a comment below and I'll make a video out of it. Thank you.